How is neuroacanthocytosis diagnosed? Have you ever wondered how doctors diagnose neuroacanthocytosis? This rare group of neurological disorders can be quite complex. It is characterized by movement issues, cognitive decline, and the presence of acanthocytes, which are abnormally shaped red blood cells. Diagnosing neuroacanthocytosis involves several steps, as there are no universally accepted criteria for its various subtypes. The process starts with a clinical evaluation. A neurologist will conduct a thorough assessment, focusing on symptoms like chorea, which are rapid, involuntary movements, dystonia, cognitive changes, and behavioral issues. They will evaluate motor function, reflexes, gait, muscle strength, and mental status. Family history is also crucial since some forms of neuroacanthocytosis have genetic inheritance patterns. Next, blood tests play a vital role in diagnosis. A key indicator is the presence of acanthocytes in a peripheral blood smear. These spiny red blood cells suggest neuroacanthocytosis when found in higher numbers. However, it is important to note that acanthocytes may not always be present, so their absence does not rule out the diagnosis. Additional blood tests may be done to exclude other conditions and assess for related disorders like A-beta-lipoproteinemia. Genetic testing is another important step, particularly for specific subtypes such as Chorea acanthocytosis and McLeod syndrome. Identifying mutations in known genes can help confirm the diagnosis. However, not all neuroacanthocytosis syndromes have identified genetic markers, which means genetic testing may not always provide a definitive answer. Neuroimaging is also utilized in the diagnostic process. Magnetic resonance imaging or computed tomography scans of the brain can reveal characteristic changes in brain structures, especially in the basal ganglia, which are crucial for movement control. These imaging studies help rule out other neurological disorders and support the diagnosis of neuroacanthocytosis. In some cases, immunohematological testing is necessary, particularly for McLeod syndrome. Specialized blood tests that check for specific blood group antigen abnormalities are conducted to confirm this subtype. In summary, diagnosing neuroacanthocytosis involves a combination of clinical evaluations, laboratory tests for acanthocytes, genetic testing when applicable, neuroimaging, and specialized blood tests for certain subtypes. Because symptoms can overlap with other movement disorders, such as Parkinson's disease, careful differential diagnosis is essential. If you suspect neuroacanthocytosis, it is important to consult with neurologists who are experienced in these rare syndromes. They may recommend a multidisciplinary approach for accurate diagnosis and management.